Ever wondered why those annoying white flakes keep appearing on your shoulders? That's dandruff for you. Dandruff is a common scalp condition that causes the skin of the scalp to flake. Think of it as snowfall on your shoulders, only less romantic and more annoying. It's not just a cosmetic concern, it can also lead to itching and discomfort. But hold on, not every flake is a dandruff flake. It's crucial to differentiate dandruff from other scalp conditions, such as psoriasis and seborrheic dermatitis. While they might look similar to the untrained eye, these conditions vary in their causes, treatments, and impacts on overall health. Psoriasis, for instance, is an autoimmune condition that affects more than just your scalp. Seborrheic dermatitis, on the other hand, is a more severe form of dandruff that can cause red, greasy, and scaly skin. So now that we know what dandruff is, let's delve into the causes. One of the main culprits behind dandruff is a fungus. Yes, you heard it right, a fungus called Malassezia. Now you might be thinking, a fungus? On my scalp? Well, before you panic, it's important to know that Malassezia yeast is a common inhabitant of our skin, including our scalp. It's not inherently harmful or problematic. In fact, it's part of the delicate balance of our skin's microbiome, the community of microorganisms that live on our skin. So, how does this harmless fungus turn into a dandruff-causing villain? The answer lies in our scalp's natural oil, sebum. Sebum, produced by our skin's sebaceous glands, is a mix of fats and waxes that keeps our skin moisturized and healthy. Malassezia yeast, being a bit of a gourmet, loves to feast on the fatty acids in sebum. Now, when Malassezia feeds on sebum, it breaks down the fats into smaller components, one of which is oleic acid. While oleic acid might not sound harmful, it's actually the key instigator in this dandruff drama. In some people, oleic acid irritates the scalp, triggering an inflammatory response. This inflammation causes the skin cells on the scalp to shed more rapidly than usual, leading to those pesky white flakes we know as dandruff. But it's not just about the yeast and the oleic acid. Everyone has Malassezia on their scalp, but not everyone gets dandruff. This is where individual susceptibility comes into play. Some people's scalps are just more sensitive to oleic acid, and it's this sensitivity, rather than the presence of the yeast itself, that leads to dandruff. In essence, dandruff is a complex dance between a fungus, our skin's natural oils, and our body's immune response. When these elements are in balance, your scalp remains healthy. But when they're out of sync, the result can be an itchy, flaky scalp. So, too much yeast can lead to an irritated scalp and dandruff, but that's not the only factor. Ever heard of sebum? It's the natural oil our skin produces. But did you know it plays a key role in dandruff? Sebum is produced by our sebaceous glands, which are found all over our body, except for the palms of our hands and the soles of our feet. On our scalp, these glands are particularly active, producing an oil that keeps our skin moisturized and our hair shiny. However, when these glands go into overdrive, they can produce too much sebum. This excess oil can make our scalp a perfect breeding ground for a type of yeast called Malassezia. You might be wondering, wait, yeast? On my scalp? Yes, indeed. This yeast is a normal part of our skin flora, living harmoniously with us most of the time. However, when there's too much sebum, Malassezia has a feast. It breaks down the sebum, producing oleic acid, a substance that can irritate the scalp and lead to dandruff. But here's the catch, not everyone with an oily scalp will develop dandruff. This is where individual susceptibility comes into play. Some of us are just more sensitive to the presence of Malassezia and the oleic acid it produces. This sensitivity can trigger an inflammatory response in our scalp, leading to the flaking and itching we often associate with dandruff. Factors such as age, hormones, and even stress can influence sebum production and our sensitivity to Malassezia. For instance, during puberty, the surge of hormones can ramp up sebum production, making teenagers more prone to dandruff. Similarly, periods of high stress can also trigger an increase in sebum production. So we've seen how a delicate balance of sebum production and individual susceptibility can influence whether or not we develop dandruff. It's a complex interplay of factors, but understanding these can help us better manage and prevent dandruff. So too much oil and a sensitive scalp can also contribute to dandruff. But how can you tell if you have dandruff? So, how can you tell if you have dandruff? It's not just about white flakes. Recognizing dandruff goes beyond the simple presence of white flakes on your shoulders. Yes, a flaky scalp is the hallmark of dandruff, but it's not the only symptom. You might also experience itching, a sensation that can range from a mild annoyance to a constant distraction. Redness, too, can be a sign of dandruff. It's often a result of the inflammation process happening under the surface of your scalp. However, it's important to differentiate between mild dandruff and more severe scalp conditions. Mild dandruff might cause a bit of flaking and itching, but severe conditions can lead to extreme redness, intense itching, and even hair loss. These severe conditions might require medical intervention, so don't hesitate to consult a healthcare professional if your symptoms are causing significant discomfort or distress. Knowing the signs of dandruff can help you take action. But what can you do to prevent or treat dandruff? Prevention is better than cure, and that's true for dandruff as well. To prevent dandruff, the first step is maintaining a healthy scalp. This means keeping it clean, balanced, and well-nourished. Regular washing is a simple but effective measure, as it helps to eliminate excess oil and dead skin cells that can contribute to dandruff. However, it's not just about how often you wash your hair, but also what you wash it with. Using a gentle pH-balanced shampoo can help to preserve the natural protective barrier of the scalp and prevent dryness and irritation. In addition to regular washing, it's crucial to maintain a healthy diet. Nutrient deficiencies, particularly in vitamins B6 and B12, zinc, and certain types of fats, can affect the health of your scalp and hair. Foods rich in these nutrients, including lean meats, fish, fruits, vegetables, and whole grains, can help to nourish your scalp from the inside out. Now let's talk about stress. Chronic stress can wreak havoc on your body, including your scalp. It can trigger or worsen dandruff by disrupting the balance of your scalp's ecosystem and stimulating excessive oil production. Therefore, managing stress through practices such as mindfulness, yoga, or regular exercise can be an effective strategy in the fight against dandruff. But what if you've tried all these preventive measures and still find those pesky white flakes on your shoulders? Don't worry, there are several treatment options available. Over-the-counter anti-dandruff shampoos are the first line of defense. These shampoos contain active ingredients that target the root causes of dandruff. Some of them, like zinc pyrithione and selenium sulfide, work by reducing the proliferation of Malassezia yeast on the scalp. Others, such as salicylic acid and coal tar, help to slow down the shedding of skin cells. For more severe cases, prescription shampoos and scalp treatments might be necessary. These usually contain stronger concentrations of active ingredients or other potent compounds like ketoconazole or corticosteroids. Ketoconazole is an antifungal medication that inhibits the growth of Malassezia yeast, while corticosteroids alleviate inflammation and itching. It's important to understand that these treatments work by managing the symptoms and underlying causes of dandruff, not curing it. That's why consistency and patience are key. Most treatments take a few weeks to start showing results, and you may need to continue using them even after your dandruff has cleared to prevent recurrence. Lastly, remember that everyone's scalp is different. What works for one person might not work for another. If you're struggling with dandruff, don't hesitate to seek advice from a healthcare professional. They can help you to understand the specific factors contributing to your condition and guide you in choosing the most suitable treatment. So now you know what dandruff is, what causes it, and what you can do to prevent or treat it. Remember, everyone's scalp is different, so what works for one person may not work for another. Don't be afraid to try different treatments until you find what works for you.